Okay, I'll give you a presentation this afternoon. I'll talk about buccal collagen film for skin improvement. Let me change this a little bit. And which the product is developed and designed and developed by Usinlabotachi company located in Seoul in Korea. Before I get into my talk, I would like to introduce myself briefly. I'm the professor of Dongguk University, Seoul, Korea, and serve as consultant for Usinlabotachi company. The contents of my talk starts from product description, background, research aim and method, result, and then I will speak about human trials and possible mode of action, followed by summary. First of all, I'd like to briefly describe our product and application method. This product was designed for oral mucosal delivery for the purpose of improvement of skin elasticity and moisturization. The product name is Collagen-Oral-Bio Film, and this product contains fish collagen hydrolysate as a peptide. The molecular weights range around 1 to 2 kilodalton, probably lower than 1 kilodalton would exist for higher transport. Each film contains 30 milligram. The shape is rectangular, as you can see here, 3.5 square centimeters and around 200 micrometer thickness. This film consists of two phases, of course. The front side is green color, which is a muco-adhesive layer, and this layer attached to the mucosa inside oral cavity. And the other side is a protective layer, which is backside. Before I get into main topic area, main result here, I'd like to briefly summarize the background of beauty market. The beauty market grows worldwide steadily, especially advanced countries like United States, France, China, Italy, and Japan. The market grows notably. Among them, United States is the number one in recent years. Among the beauty market products, the pioneer and market leading products for this area is collagen, so that a variety of collagen products are being sold as food supplements. The orally available collagen products are shown in this slide, shown as a figure. Mostly they are expected to be absorbed through intestinal tract. However, this collagen is a large molecule, so that ingested collagen would be decomposed to amino acid by our digestive enzymes, so that intact form or larger form of peptides would not be expected to be observed high efficacy. So that to overcome this problem, our company tried to put effort to develop the Collagen-Oral-Bio Film for buccal delivery, because the buccal area is highly vascularized. So our innovative formulation is to maximize the absorption or main ingredient. At the bottom of this slide shows the scheme of the absorption of collagen from our product. This muco-adhesive layer is the is the start point of collagen absorption through the epidermis of mucosa layer, and then it goes through dermis area connected with the vascular network. So we expect this low molecular weight collagen would be dispersed through this epidermis area to the nearby region and also to the vascular transport. The final slide for background information is our collagen biofilm, the collagen characteristics. As I mentioned, low molecular weight collagen is the key point for type 1 fish collagen. The reason that we use type 1 is this type of collagen is most common for the makeup of our body parts, especially hair, skin, and nails. So that type 1, if it is appropriately observed, will be helpful to support a youthfulness of skin. Right-hand side, you can see 3D structure of collagen. So collagen is protein, three different, three polypeptide intertwined together to make a polymer complex. So that it's very hard to expect to be observed through skin or intestinal tissue without digestion. The research aim include to design and create innovative product enhancing local absorption of the collagen. For this purpose, we tried three different approaches. First one is in vitro, and the second one is in vivo human trial for the evaluation of efficacy. The first assay is collagen peptides penetration assay through buccal mucosa. And second one is a volunteer human trial for the assessment of facial skin condition. Finally, we use the cell-based assays to explore the mode of action of our product. According to the literature, we were able to find the possibility that collagen peptides penetrates through mucosa, buccal mucosa. And this scheme shows product attached to the oral, on the surface of oral epithelium. To accomplish this purpose, we need to validate safe and strong attachment of our product to the mucosa, because the main ingredient may be dissolved in the saliva for degradation. In other case, this product may be dislocated by mechanical movement accidentally, so that a stable attachment is a key point for a certain period of time, which should be around 30 minutes. And then the main ingredient would go through oral epithelial layer towards capillary network. To validate our hypothesis, we used the experimental method using human oral epithelium, which was applied to the upper chamber of these two-chamber assays, and HOE was located on the upper chamber with a test solution. And then if the main ingredient goes through HOE to the bottom layer, we would be able to detect the contents in the bottom solution. In your situation, we were able to detect collagen movement through this HOE layer for the biochemical assays of collagen for ELISA and some other instrument. And second method that we used was pig mucosa tissue permeability testing using France cell. France cell is shown at the bottom of this slide, and on top we put pig swine mucosa, and then on top of it we put our film, BDF film, and then full equipped instruments are shown like this, and then we can detect collagen in the artificial saliva solution that is expected to be dissolved and pass through this swine mucosa tissue. And first result for the HOE assay, I just highlight one of the key data, which is collagen hydrolysate accumulate, as shown as a percentage and the y-axis as a function of time. We designed 3 different formulations, 1 through 3. Among these 3 different setup, we were able to find formulation number 1 was best in terms of accumulation of collagen hydrates as a function of time. This optimization process enabled us to design our final product. So in this assay, we could confirm that collagen peptide hydrolysase indeed pass through oral mucosal membrane, and the result of with other assay outcome was published in Bulletins of Korean Chemical Society, which is SCI journal. The other approach that we use using pig mucosal tissue, we subdivided our assay in terms of molecular weight of collagen, around 1 kilodalton. The other one is 3 kilodalton. As you can see and expect, 1 kilodalton fraction of collagen shows a greater extent of permeability using pig mucosa assay, and which was about on a five-fold increase compared to 3 kilodalton level. And then we were able to see the accumulation of this pass-through collagen hydrolysate around up to 40 minutes time points. So that is another approach showing that collagen peptides hydrolysate pass through this pig mucosa tissue system. Finally, we wanted to confirm our result in human. So that human trials was done to evaluate skin conditions in terms of moisture content, elasticity, and smoothness, in other words, roughness of the skin. Roughness of skin is basically detecting wrinkles and roughness and melanin and redness of the skin by using 3D imaging techniques. For this approach, we did 2 different setup experiments for human volunteers. First one is in-house panel test for the 9 volunteers, which is called single arm study. And second one is independent clinical center trial for the 22 people, which was conducted by Skin Biotechnology Center in Kyunghee University in Seoul, Korea, which was done as double-blind 2-arm trials. For this human trial measurement, we use 3 different equipments. One is a skin moisture detection by cutometer made by Germany. Skin elasticity was done by corinometer, which was also made by Germany. And skin texture, as I mentioned, was assessed by Entera 3D skin analyzer made by Ireland. And this test was done after 2 film applications before bedtime, single application a day. Total dose was 60 milligram per day because each film contains 30 milligram, which was done daily for 4 weeks. And before the assessment is called week 0. And after 2 weeks trial, we did the evaluation. And also 4 weeks, we did another evaluation. The measuring area include the cheek area and the facial skin as shown right here, left and right together, and random placement. Test result was quite promising. Skin hydration was increased at least above 15% after 2 weeks and 25% at 4 weeks of applications of our product. In both set number 1 and set number 2 shows a similar result. The percent change was greater. It looks greater even after 4 weeks treatment for the hydration of skin. Skin elasticity was also increased around the same scale, around 15% at 4 weeks. For this approach, we used skin probe and then skin suctioning. Let me see this right-hand side is the graph showing deformation of skin by suctioning of the skin using colinometer, using the probe. The pressure was around 400 millibar. And then after the release of this suctioning, skin elasticity can be detected by this curve change. As is shown by biphasic change of the deformation and the recovery to normal state. There's a rapid declining of deformation is called the UR scale, and the full recovery showing gradual recovery from the rapid, followed by rapid change, which if it is included, it's called the total recovery UA. In both parameter, R2 and R7, we were able to see that interesting elasticity improvement after application of our product. Third of the measurement was skin roughness assessment, which was increased 10% at 2 weeks of application and 4% at 4 weeks in this case. And as I mentioned, this roughness was measured by assessing 3 different places we call the spiral mode placement. And one of the example of a skin condition morphologically is shown in this slide. If you see it is at the bottom, our product application group shows initially shows a wrinkle circled by red here, and then after 2 weeks, this wrinkle was removed, and greater removal at 4 weeks of trial, whereas placebo group, which also applied our film without main ingredient, and then this nasolabial wrinkle was shows no change after placebo application. At the end of trial, we did questionnaires for the people who taken our product. Interestingly, in terms of efficacy, over 90% of people were very satisfied with our product. And another parameter, convenience of use, easy to use parameter was also very satisfactory for most of the people. More importantly, there was no adverse events or observed during our human observation. So what would be the background for the mode of action? What we suppose was a homeopathy-like effect. To homeopathy, for those of you who are not familiar with this, homeopathy is a small dose of inflammatory agent application for revitalization of immune system, which would be very good for health and wholeness of our body without no cell death. However, large dose of application, for example, even for collagen, may induce arthritis. And in another case, filler injection of collagen may cause inflammatory granuloma formation under the eye after 7 years of application. However, small dose like our product may induce hydration through slight edema formation or vascular dilatation. And then more importantly, cytokine production would stimulate the fibroblast growth, which is responsible for the matrix formation, especially collagen endogenously. To examine this hypothesis, we used the raw cell line, which is macrophage cell line, and then measured the macrophage activation using Bradford assay and peroxynitrite production and interleukin-1 alpha production as one of the important cytokines. As you can see here, in Bradford assay, raw cell activation was clear in terms of the total protein production in cultured cells for 48 hours. We compared this effect with the lipopolysaccharide. There was also increase in lipopolysaccharide, which is endotoxin. When it combined together, there was a greater increase in total protein levels. And the second measurement was peroxynitrite production, which is free radical. So this was also increased after high dose of collagen treatment for the cell, which was, however, lower than LPS itself. Again, the combination treatment shows a greater increase of peroxynitrite levels in culture media. Finally, interleukin-1 alpha production was also assessed in this conditioned media of culture cells. And the LPS shows a greater increase in IL-1 production, and collagen was less than that. Again, the combination treatments shows a greater effect in the production of the interleukin-1 alpha. So what we can expect is this interleukin would stimulate nearby immune cells and fibroblasts for growth and the generation of endogenous collagens in our skin. In summary, I would like to briefly mention that our collagen product contained in collagen biofilm indeed permeates through buccal mucosal tissue, and this penetration was verified using cell-based system and mucosal tissue examination. More importantly, clinical trial was successfully done to confirm that significant improvement was observed using our product for skin hydration, elasticity, and roughness improvement. No adverse effect were found. The hypothetical mode of action is again fast hydration and endogenous collagen production within our facial skin area, even after a daily dose of 60 milligrams, compared to a large dose of oral injection in other products like 1 to 5 grams for ordinary product. Our product was patented, and the result outcomes were published in two distinguished journals. You can easily find the result for full information to confirm that our product is indeed efficacious in human situation. Discussion, there's a growing trend of using low dose of collagen rather than as a diet collagen supplementation. We compared our product with one of the low-dose product here. Our product is again muco-adhesive double layer film product containing fish collagen peptide 1 to 2 kilodalton through oral buccal application for skin beauty. The other product of low-dose capsule was an orally ingestible product for joint health. The product's content is expected to go through pious patch in the intestine. 우신라보타치 company, the headquarters and R&D center is located in Seoul and nearby Seoul, around 2 miles away to the west. So, Incheon seaport area. It's a growing city internationally. We have a Songdo factory in Incheon area, and also we have a European manufacturing facility in Slovenia and marketing office in Kyiv and Hungary. Thank you for your kind attention. If you have questions, I'm very pleased to take. Thank you very much.
Speak? Yes.
Thank you. Does this improve the skin throughout the body or just on the face and neck?
We didn't assess the other part of the body, but since it is a very tiny amount of collagen, and the reason that we apply this product in the mucosa, oral mucosa, is the nearby facial area to be expected to be improved.
But company will try to something another bodies, so effect in future like cellulite. So we are considering. Any other questions? Is okay? Okay, so maybe we present some samples if you want. Maybe our colleagues will in the front give it to some sample of collagen. Okay, and yeah, maybe we finish now. Yes. 교수님 감사합니다. 수고하셨습니다.
Yeah, thank you very much.
Thank you. Bye bye.
Have a good time there.
Thank you very much.